Take off one sock, just one. Right now, look at the skin where the elastic pressed all day. If you can see a groove there, a clear indentation that stays for 30 seconds, a minute, sometimes longer before the skin slowly smooths itself back out, then what I am about to tell you is urgent, because that mark is not a sock problem. It is not a salt problem, and despite what 70% of people over 60 have been told by their own physician, it is not primarily a heart problem. It is a drainage problem, and the system responsible for fixing it has never once been explained to you. The water sitting in your ankle right now, and there is water there, possibly half a liter, possibly a full liter, has been pulling quietly into your tissues all day, slowly, silently, while you sat at the table, while you rode in the car, while you watched television. And tonight, when you finally lie down and think the problem has solved itself, that fluid is going to shift, it is going to migrate upward, it is going to reach your kidneys at 2 in the morning, and you know what happens next. You are up, again, and then again. And the sleep you thought you were getting is not the sleep your heart and your brain actually need. You know exactly the moment I am describing. You come home, you pull off your shoes, and there they are. Ankles that are visibly thicker than they were this morning. Calves that feel like something heavy was poured into them. You press your thumb into the skin just above the ankle bone and watch it leave a small white crater, a pit. That takes far too long to fill back in. You have been quietly living with this. Maybe you mentioned it once at a doctor's appointment, and when you did, what happened? You were asked about your heart, you were told to reduce your salt, you were handed a prescription for a diuretic, a water pill, and it barely made a difference, because nobody stopped to explain that the water in your legs was never in your bloodstream. It was in your tissues, and a diuretic cannot reach tissue fluid, it only pulls water from blood. You have been treating the wrong compartment for years. What I am going to walk you through today is not experimental. It is basic human physiology, the kind that gets taught in the first year of medical school and then somehow never makes it into a single standard appointment with a patient over 60. That gap is not an accident, and it has consequences, real consequences that I have watched unfold in patients who deserved better. Stay with me, because there is a system inside your body that was built to drain that fluid, and after 60 it begins to fail in a very specific, very correctable way. Understanding how it fails is the first step to reversing it. And when we get to number 4 on this list, I want you to remember this moment, because that single point alone has fundamentally changed the health outcomes of patients I have been treating for decades. Patients who had been suffering unnecessarily for years. Do not miss it. I am a vascular surgeon. That is the only credential you need from me today. Not a title, not a biography. What matters is what I have seen in the operating room, in the consultation room, in the follow-up appointments where a patient sits across from me and tells me nobody ever explained any of this to them before. 23 years of practice. I have operated on legs. I have seen what happens to tissue that has been chronically saturated with fluid, tissue that hardens, tissue that changes color, tissue that becomes vulnerable to wounds that will not heal. I have seen it in bodies of people who were following every piece of advice their doctor gave them faithfully every day and still suffering. I had a patient, 67 years old, retired school principal, meticulous woman who walked 2 miles every single morning before breakfast. She had eliminated salt almost entirely from her diet. She was on 3 medications, including a diuretic she had been taking for 4 years. Her ankles were worse than when she started all of it. When she came to my office, she had reached the point where she genuinely believed this was just what aging looked like, that the body simply deteriorates and you manage it as best you can. She was wrong, and the correction was not complicated, but it required understanding something that not one of her previous physicians had taken the time to explain. Something I will explain to you in full today. That is what I am here to do. There is a gap between what medicine knows and what patients are actually told. I have watched that gap do damage, quiet, accumulating, entirely preventable damage to people who were doing everything right. The problem is not that medicine lacks answers. The problem is time. The average physician appointment is 11 minutes. There is not enough space in 11 minutes to explain the lymphatic system, distinguish between venous and lymphatic edema, describe the nightly habits that worsen or improve drainage, and identify the warning signs that separate a home manageable problem from a medical emergency requiring immediate attention. 11 minutes is not enough. So most of those things never get said. What I am offering you today is the appointment you never received, the one where someone finally has enough time to say everything. No clock on the wall, no waiting room full of other patients, just the information you needed and were never given. Let us begin. I want to start with the point that surprises people the most because it involves a system inside your body that most people over 60 do not even know exists. A system that is failing you right now, silently, every hour you remain sitting still. Here is what is actually happening inside your leg. Your body runs two separate fluid systems. Most people are aware of only one: blood. Arteries carry oxygenated blood out from the heart. Veins carry used blood back. That system has a pump your heart, and it runs automatically every second of every day, without you having to. Think about it. The second system has no pump, none whatsoever. It is called the lymphatic system, and its job is to collect the fluid that constantly leaks out of your tiny blood vessels into the surrounding tissue. Think of your tissues as a field of soil after a rainstorm. Water soaks in everywhere into the ground, into the roots, into every gap. Something has to move that water back out before the field floods. That is what your lymphatic system does. It collects approximately 2 liters of this fluid every single day, fluid loaded with cellular waste, dead bacteria, and excess protein, and channels it through a network of vessels back into circulation. But those lymph vessels have no heartbeat driving them. They only move when you move. Every step you take, every time your calf muscle contracts, every time your ankle flexes, you are squeezing the lymph vessels like a tube, pushing the fluid upward. Valves close behind it to prevent backflow. Progress is made. Stop moving entirely. Sit for 3 hours without getting up and the entire system stalls. The fluid stops moving, the reservoir grows. When you were 30 years old, this was inconvenient but self-correcting. The lymph vessel walls were elastic. The valves inside them were tight and crisp. A short walk could restart the whole system within minutes. But after 60, 3 things happen simultaneously, and this is the mechanism nobody has explained to you. The lymph vessel walls begin to stiffen. The one-way valves inside them start to leak backward, and the connective tissue around the ankle, the loose matrix that gives fluid its proper boundary, loses its structural integrity. Fluid seeps out faster. The drainage system moves its lower. The math stops working, and the pool grows deeper every single day. What truly frustrates me, what has frustrated me for 2 decades, is how many people over 60 are living inside this problem right now and have been given a water pill as the entire answer. The pharmaceutical industry profits from treating the symptom. There is no patent on understanding your own physiology. There is no prescription for walking for 90 seconds every 45 minutes. And so that information, the information that would actually help, never gets packaged and delivered the way a pill does. You were not failed by laziness. You were failed by a system that had no financial incentive to tell you the truth. Now that you understand what is actually happening inside your body, I want to give you the 5 things you must know. Let us start with number 1. Number 1. Your lymphatic system is the only drainage network in your body that has no automatic pump, and after 60, the backup mechanisms that once compensated for it are gone. Most people, when they notice ankle swelling, think immediately about the heart. The heart is weak. The heart is failing. That conclusion is understandable. Doctors have pointed there. News programs have linked swollen ankles to cardiac disease for decades, and years of that message make it feel like settled fact. But here is the problem with that assumption. For the majority of seniors experiencing gradual, symmetrical evening worse, morning better leg swelling, the heart is not the primary driver. The lymphatic system is, and the distinction is not academic. Treating a lymphatic problem as if it were a cardiac problem is not just ineffective. It subjects you to medications with real side effects that never touch the actual cause. Here is the biological reality. Your lymph vessels, the vessels that drain excess fluid from your tissues, function like a passive conveyor belt. The mechanism that drives them forward is muscular compression. Specifically, your calf muscles. When the calf contracts, it wraps around the surrounding lymph vessels and squeezes them. Think of pressing your thumb down a soft rubber tube and the fluid moves upward. Valves snap shut behind it to prevent backflow. Progress is locked in, but stop contracting. Stop walking. Sit for 3 hours, and the belt stops entirely. The fluid simply accumulates in the tissues around your ankle because there is nothing to move it anywhere. I had a patient, 72 years old, retired engineer, the kind of man who kept a personal spreadsheet of every health metric he measured. He came to me convinced his heart was failing because his ankles had swelled dramatically over 6 months. His cardiac workup was completely normal. His heart was functioning well, but he had retired 8 months prior, and in that time his daily step count had dropped from 6,000 to under 800. He read, he worked on puzzles, he sat, and the lymphatic system that had compensated quietly for years finally could not keep up without the movement that powered it. If you continue sitting for 4, 5, 6 hours at a stretch with no deliberate movement, the stagnant fluid in your tissues is not merely uncomfortable, it creates a low-grade inflammatory environment that damages the lymph vessel walls, accelerates valve deterioration, and makes every subsequent day of swelling worse than the last. The system does not plateau, it declines. The intervention is specific and immediate. Set a timer for 45 minutes. Every time it goes off, stand and perform 20 heel raises, rise onto your toes, lower back down, 20 repetitions. That motion contracts the primary lymphatic pump for the lower leg and restarts drainage within minutes. No equipment, no gym, 90 seconds of your time. You can begin today. I want you to. Number 2 is the one I almost did not include in this video. My colleagues will disagree with me on this point, but after what I have seen, I owe it to you to say it plainly. Number 2. The water pill your doctor prescribed is making your drainage problem worse, not better. I want to be direct with you about this, because this is the piece of information that makes some physicians uncomfortable. The diuretic, the furosemide, the hydrochlorothiazide, whatever version is in your medicine cabinet, is a genuinely effective medication for a specific type of fluid retention, but only one type, and using it. For the wrong type does not simply fail to help, it creates new problems on top of the original one. Here is what most people believe. The legs are swollen, there is too much water in the body, a diuretic removes water. The logic seems airtight, and for cardiac edema swelling driven by a heart that cannot process its fluid load, it is correct. The fluid is in the bloodstream. The kidneys can pull it out. The diuretic does exactly what it promises. Those patients need it and benefit from it directly. I prescribe it without hesitation in the right context. But for lymphatic edema, the water is not in the bloodstream. It is in the interstitial space, the loose connective tissue between your cells. Outside the reach of the renal filtration system, a diuretic operates through. The drug tells your kidneys to filter more water out of your blood and send it to your bladder, if the water was never in your blood to begin with. The medication has nothing to work with. Your blood volume drops, your kidneys compensate, your tissues stay saturated. And in the meantime, you are losing potassium, losing magnesium, standing up too fast and getting dizzy, and running to the bathroom throughout the night. All the side effects, none of the benefit. I had a patient 69 years old, a retired nurse, someone who understood medication better than most. She had been on a diuretic for 3 years for bilateral leg swelling. She was chronically fatigued by early afternoon. She had painful nighttime calf cramping despite supplementing potassium daily. Her ankles were still swelling. When we properly identified her condition as lymphatic in origin and carefully transitioned her off the diuretic with appropriate medical supervision while implementing the correct interventions, her ankles were better within 8 weeks than they had been in 4 years. She sat in my office and cried. Chronic diuretic use in lymphatic edema depletes potassium and magnesium, stresses the kidneys, and may trigger reflex fluid retention as the body fights to protect its blood volume, a cycle that looks like worsening disease and prompts higher doses of the same drug that was never addressing the right problem. Do not stop a prescription diuretic without your doctor's knowledge. That is not what I am saying. What I am saying is this. At your next appointment, ask these exact words: is my swelling venous, lymphatic, or cardiac? Because I have learned diuretics are most effective for cardiac edema. I want to be sure we are treating the right source. That question will change the conversation. Now, before I give you number 3, I need you to stop and think about something for a moment, because the next point connects directly to what I just told you. And if you miss the link, you will miss everything. Number 3. There are 3 completely different causes of swollen ankles in people over 60. They look almost identical from the outside. Only one responds to home management, the other to require a physician, and one of them requires a physician today. Most people treat all ankle swelling the same way: elevate the feet, reduce salt, take the water pill, and that approach is understandable, because from the outside, swollen is swollen. A groove pressed into the skin looks the same whether the underlying cause is a failing vein, a stalled lymphatic system, or a heart that is approaching its limit. But what helps one pattern can be entirely useless or actively dangerous for another, and confusing them can cost critical time. Pattern 1 is venous. The one-way valves inside your leg veins, tiny structures designed to prevent blood from falling backward toward the ankle, have weakened or collapsed entirely. Blood pools in the lower leg. The pressure inside the vein rises until water is forced through the vessel wall directly into the surrounding tissue. You will almost always see visible evidence: varicose veins, a brownish or reddish discoloration on the shin just above the ankle, and swelling that is dramatically worse after a day spent standing rather than sitting. The swelling feels heavy and tight. It often aches by evening. Pattern 2 is lymphatic. This is the pattern I have been describing. The drainage system has slowed. The swelling is soft at pits when you press it, leaving that crater you may have already noticed. It typically involves the top of the foot, the area right behind the base of the toes, and here is a clinical detail that identifies it precisely. If the lymph swelling has been present for years, the skin on the top of the foot becomes so thick and so hardened that you genuinely cannot pick it up between two fingers. That specific finding a skin you cannot pinch points directly at lymph, not veins, not the heart. Pattern 3 is cardiac or renal. Both legs swell at the same time. The swelling is accompanied by shortness of breath, particularly when you lie flat. You wake up gasping. You cannot climb a single flight of stairs without stopping to rest. You have gained 4 or 5 pounds in 1 week without explanation. You wake up multiple times at night to urinate. Any one of those companions alongside ankle swelling is a signal. Stop managing this at home. Be seen by a physician this week. I had a 74-year-old patient, retired contractor, a physically strong man who prided himself on never complaining, who had been elevating his feet at home for months while telling himself it was just his age. When he finally came in, he was in early-stage heart failure. 3 months of delay had cost him. The window that might have caught it earlier was gone. If pattern 3 describes you at all, even partially, this video is not the right place to spend today. Make the call. Number 4 is the reason I made this video. Everything up until now was leading here. Please do not click away. Number 4. What happens to the fluid in your legs the moment you lie down at night, and why it is quietly destroying your sleep, your blood pressure, and your cardiovascular health while you believe you are resting. Most people assume that going horizontal solves the swelling. The fluid was in your ankles all day because gravity pulled it there. Now you are flat. Gravity stops. Problem solved, you think. It is not solved. What actually happens over the next 2 hours is more complicated and more damaging than most people realize. When you lie flat after a day of significant fluid accumulation, that tissue fluid begins re-entering the bloodstream. Your lymphatic and venous systems, now freed from working against gravity, begin returning the day's accumulated fluid back into circulation. Over the course of 1 to 2 hours, your circulating blood volume rises noticeably. Your kidneys sense the surplus immediately. Their response is to filter rapidly to push that excess fluid into your bladder as fast as the system allows. This is why so many people over 60 wake at AM, and then again at AM, and sometimes again at AM. In many cases, it is not a bladder problem. It is a redistribution problem. The fluid that spent all day in your ankles is now moving through your kidneys in the middle of the night. That repeated interruption of deep sleep is not merely inconvenient. Each disruption suppresses the hormones your body releases during deep sleep to repair blood vessel walls, regulate blood pressure overnight, and reset insulin sensitivity. One bad night, the body compensates, a pattern of 3 and 4 awakenings per night sustained over months or years is a direct accelerant of cardiovascular damage. The connection between swollen ankles and poor heart health is real, but the mechanism most people assume is not the correct one. The swelling itself does not damage the heart. The sleep destruction it triggers is what does the damage, silently, over years. I had a patient, 71-year-old retired pharmacist, a woman with an impressive understanding of medications. She came to me because her blood pressure had become impossible to control despite 2 antihypertensive drugs. During our intake conversation, I asked about her sleep. She told me she woke 3 times a night every night. To use the bathroom, she assumed it was age. I asked about her ankles. She rolled up her pant leg without a word and showed me what had been building for years, quietly and completely unaddressed. When we implemented a timed pre-sleep drainage routine, her sleep improved within 3 weeks. Her blood pressure dropped measurably within 6, without adjusting either medication. The technique is specific. 2 hours before bed, not right before sleep. 2 hours before, elevate your legs above the level of your heart. Not on a pillow. Use a wedge that brings your feet genuinely higher than your chest, or lie flat with your legs against the wall at a 90-degree angle. Hold this for 20 minutes. This allows fluid to drain back into circulation before midnight, giving your kidneys time to process it while you are still awake so you sleep through. Begin tonight, not next week. Tonight, what comes next, number 5, is what my patients thank me for the most. Not because it is the most dramatic thing on this list, but because it is the most immediately doable. And sometimes that is exactly what saves a life. Number 5. I have saved this one for last deliberately, because what I am about to tell you contradicts something that almost every senior with swollen ankles has been told or has assumed for years. And the mainstream medical community does not widely promote this. But the evidence and my patients tell a very different story. Here is what you have probably been told. compression stockings, wear them during the day to keep the fluid from accumulating. Take them off at night when you lie down. That is the standard recommendation. It is not wrong, exactly, but it is incomplete in a way that eliminates most of the benefit and leaves people wearing uncomfortable garments and wondering why their ankles are still swelling the same way. Here is what the standard recommendation misses: compression stockings do not drain fluid. They prevent fluid from entering the tissues while you are upright. That is a critical distinction. If you have already accumulated significant fluid by the time you put them on, if you wake up, shuffle to the kitchen, sit at the table for an hour, and then pull on your stockings, you have already lost. The fluid is already in the tissue. The stocking is now simply compressing a saturated sponge. You feel tighter, you feel more uncomfortable, and the drainage you were hoping for does not happen. The revelation is this: compression must happen before the fluid accumulates, not after. The stockings must go on before your feet hit the floor in the morning, while you are still horizontal, before the first step introduces gravity back into the equation. That 5-minute window, still in bed, pulling on compression before standing, changes the entire effectiveness of the garment. In clinical practice, I have seen patients go from moderate swelling despite daily stocking use to dramatically reduced swelling within 2 weeks simply by changing when they applied them, nothing else. I will be honest with you. This is something I tell my own father. He is 74 years old and has been fighting bilateral ankle swelling for years. He was doing everything he was told and still waking up with heavy swollen legs every morning. When I sat with him and explained the timing, not a new prescription, not a new device, just when to put on what he already owned, the change was visible within 10 days. He called me and said, "Why did nobody ever tell me that?" I had a patient, 68-year-old retired librarian, quiet woman, the kind who followed every instruction she was given to the letter, who had been wearing compression daily for 2 years with minimal improvement. When we changed only the timing stockings on before rising, combined with the heel raises from point 1 and the pre-sleep elevation from point for her evening swelling was reduced by more than half within 3 weeks. She came back to my office and stood in the doorway and said, "I feel like I got my legs back." The swelling that you have been managing or failing to manage for months or years is not a permanent condition you must simply endure. Your body still has the ability to drain. It needs the right sequence, applied at the right moment. We are almost at the end, but before I close, I need to say something to you directly. Something that is not on this list. Something I say to every patient who sits across from me in my office. Stay with me for 2 more minutes. Let me leave you with the 3 things from today that matter most. First, your lymphatic system is a passive drainage network with no automatic pump. After 60, it requires deliberate, consistent movement to function, specifically calf muscle contractions every 45 minutes, 20 repetitions. That is not optional. That is the pump. Second, the fluid that accumulates in your legs during the day does not stay in your legs at night. It redistributes into your bloodstream and reaches your kidneys at 2 in the morning. 20 minutes of elevated legs 2 hours before bed intercepts that process before it steals your sleep. Third, compression stockings go on before your feet touch the floor in the morning while you are still horizontal. That single timing change transforms a marginally helpful garment into a meaningful clinical tool. Now I want to step away from the list for a moment. I have been practicing medicine for over 2 decades, and the thing I have learned, the thing that no medical school teaches, that no clinical rotation prepares you for, is that the most dangerous thing standing between a person and their health is not a disease. It is the belief that they have already tried everything, that the information they have been given is all the information that exists, that the way things are is the way things will stay. You were not given the right information, that was not your failure. But now you have it, and what you do with it, that part belongs entirely to you. I am not asking you to transform your life overnight. I am asking you to set a timer for 45 minutes, to spend 20 minutes against the wall before dinner, to put your stockings on tomorrow morning before you stand. Those are small things. They take less combined time than a single television program, and they work. I have watched them work, one patient at a time, in a small office where I have spent the better part of my career saying things that 11-minute appointments never leave room for. Your heart does not send warning letters. Your lymphatic vessels do not give you a written notice before they fail completely. The window you have right now, this exact moment, is valuable. Use it. If this video reached you today, do not let it be the last time. Every week, I release information that your doctor genuinely does not have the appointment time to share with you. That is not a criticism of your physician. It is simply the reality of the system they work inside. Subscribe, turn on notifications, because the information I am releasing next, it connects directly to what you learned today, and it may be the most practically important video I have ever made. Next, I want you to watch the video on nighttime leg cramps because the same lymphatic mechanism we discussed today is responsible for the cramping that wakes you at 3 in the morning, and the fix overlaps almost completely with everything I told you here. Take care of yourself because you deserve not just a longer life, but a better one. I will see you in the next video.